20 takes, 20 takes. Patient electronic signature. It's really awesome whenever you're able to have a paperless process and a positive patient experience, but those two aren't always linked. Sometimes you can have a paperless process, but a really crummy patient experience. So that's what we're going to talk about in this session. Okay, so patient electronic signature is really in vogue these days. A lot of hospitals want to get this solution, and most often they're wanting to start using patient e-signature in the registration area, which makes sense. That's where all the patients come in. That's where some very simple forms reside, just a general consent for treatment, your HIPAA acknowledgement. Those kind of things are real simple. They're pretty much boilerplate forms that just have a sign here type of a situation. So again, eSig and Reg makes a lot of sense. But in many cases, we've seen eSignature and Reg go so wrong from a patient experience standpoint that the registration staff, unbeknownst to IT, stop using the technology altogether, and they print paper off and just give the patient the paper copy to then sign. All right, so why do this? Why is the registration staff doing this? Well, again, eSignature, while it can provide a paperless process, that doesn't necessarily mean that you're providing a good patient experience. If the patient experience is so bad, that's where we see oftentimes the registration staff reverting back to that paper. So what happens to cause the bad patient experience? There's a couple of things here that we've seen. One is the LCD devices, or better stated, the quality of these LCD devices. Now, we've all signed up on things electronically before. You've gone to the hardware store, you've gone to the mall, we've used LCD devices whenever we've made a purchase with a credit card and sign here. That's okay, and to do that. But in many cases though, we've all experienced where those devices are less than ideal. You sign your name, and the signature's all pixelated. It doesn't look like your signature. The blunt object that they give you doesn't feel good going across the screen. And sometimes, we've seen those screens so cloudy, so scratched up that you can't even see your signature. So that's the kind of thing that you don't want in your hospital. Don't get those kind of devices, those low quality devices to put into your hospital. Avoid that. Now, the other thing that oftentimes comes up, and this is what a big problem is that oftentimes causes the process to go back to paper, is you're asking the patient to sign off on a form when what you're presenting to them is, on these LCD devices, is just a line with an X next to it. That might be okay if you're buying a gallon of milk, if you're buying a sheet of plywood at the hardware store, but asking the patient to sign off on a consent form or sign off on a HIPAA acknowledgement when you're just presenting them a line with an X next to it, that's a big ask of that patient. And a lot of patients are uncomfortable with that. They say, wait, what am I signing here? I don't know what I'm signing. The patients are coming through your door, they're at a heightened state of anxiety and agitation. They're not coming in to just, again, buy a t-shirt or a gallon of milk. They're coming in for a medical procedure. That's not something that we do every day. People get nervous about that. So if you're asking them to sign just a form with just a line with an X next to it on that LCD device, you're asking the patient to really come a long way, and a lot of patients are just not comfortable with that. So if you're looking at the hardware, there's a couple of things to consider. Does your hardware just have a line with an X next to it where you're having to present that patient a laminated copy of that form? That's not the most ideal state. There's some other devices, some other LCD devices, if you want to use that you're actually able to put some form relevant content on those devices. While it may not show the entire form on that LCD device, it might say something even personalized like, I, patient name, hereby provide the hospital consent for treatment, and I acknowledge this, that. Same thing for the HIPAA acknowledgement. I, patient name, I'm aware of HIPAA acknowledgement, right? And then they can sign off on that. So at least there's some connotation as to what they're signing. But we're seeing also, as far as the hardware is evolving, a lot of people are wanting to move towards tablets. And tablets are really great in that they can present the entire form factor to the patient, so they can look at it, they can read the form, they can digitally sign it. And tablets are really good from a mobility standpoint at the bedside. And there's some scenarios where tablets are good in the registration or patient access areas. You might want to say, hey, take this and go have a seat, fill it out, and bring it back up, just like you would maybe a clipboard. A lot of people get nervous about those devices running away. So we're seeing a lot more LCD devices show up that are larger, that can actually show the full form factor, and they're tethered via USB back over to that registration clerk's workstation. The point is, though, if you're using poor hardware that's all scratched up and it's a bad experience, it's not going to be the first impression that you're going for your hospital. Consider that. Secondly, if you're just having the patient sign off on a form with a device that all it can do is just a line with an X next to it, you're asking the patient to come a really long way from a comfort level to sign off on those forms. Hope this has been helpful and informative. Thank you very much for watching, and stay tuned. We got a lot more of this good content coming out. Take care. All right, guys, thanks a lot for checking out this video. Really appreciate it. So if you like what you saw here and you want to be notified whenever we bring out new content, just hit that subscribe button, hit the like button, and you'll get the notifications whenever we bring stuff out. So thanks again for coming here and checking it out. Have a good one. I didn't like that too well. What else should I say? Same thing, more or less, just less stupid? That's what they typically say, right?
Yeah. Do it again.
Right.
Say something else. There you go. That's what I gotta tell you.
Do it again, but say something else. All right. All right, thanks a lot for watching this video, guys. Hit the subscribe button and you'll get notifications every time we come out with amazing content, just like what you saw. Was that worse?
Yeah, see that.
Whatever, that's fine.
That's
yeah,
better.
yeah, it's better.
That's great coaching.
Yeah.
So.